Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on both AT&T UVerse on Channel 99 and the WOW cable network. I'm Dr. David Balle, and I'm your host for In a Heartbeat. I'm so very pleased to be able to bring to you today Dr. Abdelkader Hawasli. Dr. Hawasli is a well-respected, noted, and recognized general surgeon who's often mentioned in Hour's Top Doc issue, including its most recent one. He is an assistant clinical professor at both Wayne State University School of Medicine and the newly formed Oakland Beaumont Hospital Medical School. Dr. Hawasli is the director of Bariatric Surgery at Beaumont Grosse Pointe and also the director of the Laparoscopic Fellowship Program at St. John Hospital. And I'm very happy to bring to you Dr. Hawasli. Dr. Hawasli, welcome to In a Heartbeat.
Thank you, David. I appreciate you inviting me to this session of your talk.
The pleasure is mine. I'm very excited about it. Dr. Hawasli, you've become very involved in bariatric surgery or weight loss surgery for adults, and I understand also adolescents, which I wasn't aware about. And I'd like to start out just by talking a little bit about the problem with obesity in the United States, and maybe you could tell us a little bit about how significant that is.
Actually, obesity is a big problem in the United States. About 60% of the population of the United States are overweight, and in Michigan, we have about 25 to 30% of the population in the obese category. There's a lot of burden on economics, but more important really on health issues. Obesity can increase the risk of diabetes of 400%, increase the risk of cardiac issues 75%. And if you wanted one treatment of one problem would be diabetes, is by bariatric surgery. And that has been proven actually recently in recent articles that bariatric surgery can treat diabetes effectively. And think about a lot of people who are on insulin and they have to inject themselves every day. When they have the surgery, they're off insulin either immediately or within the first month or two of their procedure.
That's amazing, and I think you have some examples that we can talk about a little bit later in the show. Could you explain to our viewers what is bariatric surgery?
Bariatric means treating obesity by surgical procedure. You have multiple ways to treat obesity. Diet and exercise. You have procedure surgical, and of course the NIH in 1991 put criteria to who really can be treated by surgery and who should be treated by medication or exercise and diet. The BMI is one way for us to check on how obese a patient is. The normal BMI, which is called body mass index, and basically is a simple way of calculation the height and weight. And if the patient falls between 18 to 25 BMI, that's normal. If you go above 25 to 30, then you become overweight. This category usually treated by simple diet and exercise. If you go from 30 to 35 BMI, that is in the overweight category that needs to add maybe medication to bring, in addition, of course, to the exercise and diet. When you go above 35 BMI, that's what the NIH put down that really these people will not do well with just diet and exercise, and they need to add the bariatric surgery, where if they have additional component to the obesity, which is if they have comorbidity, that means they have either diabetes, hypertension, arthritis, reflux, that get worse by the obesity. If your BMI above 40, that's called morbidly obese. And the word morbidly means, of course, death. But if you recognize how many deaths related to obesity in the United States is about 300,000 a year.
That's amazing.
It's
and
amazing.
How would you compare that to other diseases?
Well, if you take breast cancer combined with colon cancer together, mortality is 90,000.
That's quite a difference.
You see how much we spend in pushing people to have a screening mammography and having colonoscopy. We don't see a lot of work has been done to push people to have diet and exercise, and even needing surgery if they go over the 35 BMI.
I took a look at your BMI index, and I think many people would be amazed where they fall on that. It's pretty telling.
It's very interesting. Also, there's a lot of websites actually you can go to that can calculate it for you if you don't want to calculate it yourself.
That's a great idea.
And actually, you can see a chart right there that tells you the height and weight in pounds and in inches and feet, and you can pretty much calculate where you're at from that chart, or you can go to a pre-calculation or a calculator in the internet, and you can plug in your height and weight, and it'll give you your BMI right away.
And we see more and more in the news today about what a problem and issue it is for adolescents and children to be overweight and to be obese, and the health implications of that. And that unfortunately is a growing issue. And I'm very fascinated to hear what you're going to have to say about that. And so I'm just going to ask you, Dr. Hawasli, if you could tell us what are the different types of weight loss or bariatric surgery, and at any point you can tell us some of the things that you're doing with adolescents.
Actually, if we go to, before we go into the types, I'll let you know that 75% of obese children that would become obese adult. So you have only 25% that will escape that. So it's really a serious issue in children, and when they become adolescent and they have issue afterward with diabetes and hypertension and all these complications from obesity. I have interest in adolescents because insurance have put a restriction on covering the surgical procedures, and the above 18-year-old they can have the surgery. However, if there is an adolescent who the family wants to pay for their own surgery, they can have it as well. The interesting thing I was going to mention to you about the youngest patient that I've operated on was 14 years old.
Yes.
She weighed 400 pounds initially. She was in a boot camp, and she had been tried all medical weight loss and failed. Most she could lose was about 20 pounds and gain it back again and gain more. She's homeschooling, actually, because of the problem at school with being teased by her friends and classmates. But the family were desperate, and they sought the surgical procedure, and she's so happy that she had the surgery. Actually, we did her surgery yesterday, and she's
really?
very, very, very happy. And probably in the future we can bring her on your show.
That would be wonderful. If you wouldn't mind doing that, if
Sure.
she wouldn't mind, it would be, I think, a wonderful educational experience.
I think that we need to let the public know that there is a treatment for obesity in adolescents and young adults. And I have at least a group of patients that I have followed from the youngest being the 14. The next one was like 16 years old up to 25-year-old. And I have an interesting story about one of the kids that we did was an 18-year-old. The mother had to wait until he's 18-year-old to be covered by surgery. And he had reflux at age 10. And she was really trying anything to try to get him to have a procedure done. And finally, she came to me, and we were able to fix the reflux and the obesity problem in one operation. And when he came in the office about 6 weeks later, he lost about 35 pounds. The mother told me that he never smiled since he was 10 years old, and now he's so happy about what he went through.
That
and
is
he's
wonderful.
And she wanted to know what can she do to let people know what difference has this made on her son.
I would just like to mention to our viewers, I've known this for a long time, and for those of you who don't, Dr. Hawasli is really a pioneer in surgery. He was the first surgeon in Michigan to do a laparoscopic gallbladder removal. And not only with that, but he's pioneered and been on the cutting edge of many surgical procedures that I think you should be aware of.
Well, thank you very much. Appreciate it.
Very talented, very innovative, very forward-thinking, and a wonderful reputation.
Thank you.
Maybe you could go through us a little bit about what are the different types of bariatric surgeries?
Sure. There is basically 4 different types of bariatric procedures. 2 of them are considered non-physiologic, and 2 are considered physiologic. The procedure that you see on the screen right now is called the Roux-en-Y gastric bypass. This is the most commonly done operation. It depends on making the stomach smaller and bypassing the small intestine. So you have a small volume of food to eat, but not only that, you don't absorb most of the food that you eat because of the bypass of the small intestine. It's a good operation for weight loss. Patients can lose about 70 to 75% of their excess weight. And there's a problem, of course, with this operation. There's no operation without problems, so we will mention that there are some risks to the operation. You have to chase some vitamin problem with absorptions, problem with the minerals, calcium, vitamin D, iron absorption, and nutrients. So you have to be watched carefully after the operation to make sure that there's no side effect to the operation. It is done open, but recently has been done laparoscopic also, with the good results. The risk over time, there is potential for narrowing of the opening of the intestine that may require reoperation. There's potential for bowel obstruction. And don't kid yourself, any operation the patient can overcome and gain the weight again. Yes. So that's something you have to put in mind, that you don't want to go into an operation if you don't have the right mindset that you want to lose the weight. The other operation is a biliopancreatic diversion. Not very many people do this operation. However, it's very effective actually, and it loses up to 80% of the excess weight. It does bypass a lot of the small intestine, so you can imagine how much malnutrition you can have. Basically, this operation cuts the stomach longitudinally, and that is probably one of the operations that we're going to be talking about later that stemmed from this one, by cutting the stomach and making it smaller, but also you bypass the small intestine and you only have a small short segment of small intestine when the food mixed with the bile and the pancreatic juice to be able to be absorbed. It does have severe malnutrition potential if it is not followed properly, and also vitamin deficiencies. This usually is done open procedure that is not laparoscopic.
Dr. Hawasli, I think you brought out a great point, is that with any type of procedure, including these, a patient really has to have a mindset of a lifestyle change. It's not, nothing really is a quick and easy fix.
Exactly, and that's why we stress, we give seminars to the patient every 3 weeks, free of charge, of course, have them come in and listen. And we tell them all the different procedures, and they are required actually to have a psychiatric evaluation. They have to have behavioral modification classes and diet classes. Having a surgery doesn't mean you're going to lose weight automatically. It's a tool that levels the playing field for the patient. So now he has a control. He can either make it or break it. If he is serious about weight loss, he can lose the weight. The tool he has. Before surgery, it's a problem. These patients, they have problem with feeling hungry all the time. They have to eat. Some of them are stress eaters. Some of them are carbohydrate, chocolate lovers. So there's a trade here that you have to do some lifestyle changes, but now you have a tool in your hand where it makes it easier for you than before.
These people have such a psychosocial impact on their lives. I think you were mentioning many people are withdrawn. They have a low sense of self-esteem. They are not socially interactive. And you have some wonderful stories that we're going to get to about some of your successes.
That's amazing things. And actually, that's one thing that's rewarding for me when I see the patient in the office. And I'll mention that after we talk about the next 2 procedures.
Yes,
because the next 2 procedures actually are physiologic procedures. What do I mean by that? Physiologic means everything you eat, it'll be absorbed. So whatever meal you put in, it'll get through the intestine and be absorbed. That means you don't have the same side effects that you have with the previous 2 procedures that I mentioned, because the other ones depended on malabsorption, not absorbing all the nutrients that you took, all the calories. These 2 operations is the lap band, and next one would be the sleeve. The lap band is the simplest, easiest operation to be done laparoscopically. That means it's done through 4 or 5 puncture holes. The patient goes home the next day. The worst pain in the first 2-3 days. By 1 week, they go back to normal activity. And basically what you do is you put a silicone band around the stomach entrance, creating a small pouch. So when you eat, the band acts as a stoppage for the food to stay in and make you feel full, so you don't eat for about 2 or 3 hours. The procedure is reversible. That means you can take the band out if it doesn't work for you, but we don't advise that. We say when you put the band in, it's for life. Actually, insurance companies don't cover more than one bariatric surgery lifetime.
Oh, really?
You know, so you have to choose the right operation for you. The lab band was introduced into the United States in 2001. We've been doing it since 2004. It can be of good results and not so good results. Patients have the control. Imagine, even if it is an opening in the middle, if you take a milkshake, it's going to go in easily.
Yes.
So
yes.
2,000 to 3,000 calories can go in right away, and you're not going to lose any weight. And that's why I said if you're not in the right mindset to have the surgery, don't have the surgery. The lab band weight loss expected is 1.5 to 2 pounds a week, but it depends on the patient. They can make it better if they exercise more and they stick to the diet. The latest operation actually is called the sleeve gastrectomy. Sleeve gastrectomy, it's by narrowing the stomach to almost like a tube, so it looks like a sleeve. And actually it was a procedure that stumbled on by the predecessor of the biliopancreatic diversion that I mentioned to you, where you cut the stomach longitudinally. The patients who were very heavy, over 55 or 60 BMI, they could not undergo the operation in one setting, which means the biliopancreatic diversion. So they broke it in 2 halves. The first half was to cut the stomach longitudinally, and the second half was to bypass the small intestine. So after a year, the patient found that they lost enough weight, and they didn't want to go for the other half. So in 2007, in March, they came with a report saying that this can be really done as a standalone operation. And since then, we've been doing it. And actually, I'm amazed by the results of this operation. It's a great operation. The advantage of it over the other surgeries, it takes away the ghrelin hormone. A ghrelin hormone is a hormone discovered in 2002 that affects the appetite. And it's produced by the fundus of the stomach. So when you remove that part of the stomach, you reduce tremendously that hormone. So one thing in these patients, they don't have hunger feeling.
And they eat because has to be a key.
Absolutely. And they have to remember to eat. And actually, that's one thing that's different than the other operations.
I can tell you I'm not one of those people who has to remember how to eat. It always comes up.
Yeah. And the advantage of this surgery is laparoscopic, so it's overnight hospital stay. The worst pain in the first 2 or 3 days. By 1 week, they go back to normal activity. The weight loss that you see from this, if the patients really follow the instruction, they can lose 100 pounds in 6 months.
Amazing. Now, is this something that you want to show us here?
Well,
Dr.
this is the
Hawasli?
example of the lab band. That shows the ring that it goes around the stomach. And there's creating the small pouch right here. This ring is attached, as you see here, to a port that is put underneath the skin. The port has connection to these balloons that are inside the band, where we can inject fluid in and take fluid out to adjust that band.
I see.
So that band, this procedure requires frequent office visits to adjust the band. And this is the port here, and there's the connection to the band that is inside, and the balloons, you can see one inside there. So that requires office visits to have the patient come in to put fluid in, take fluid out, and if they're going for an operation, we take the fluid out so they can be able to vomit if they have an anesthesia problem or anything like that. So this is the lab band procedure here, and it is actually, as I said, the simplest, easiest operation to do.
What I'd like to do next, Dr. Hawasli, and I want to make sure we get this in, you have several before and after pictures of patients who've undergone the procedure, this type of procedure of various ages.
Right.
And let's go through those at this time.
All right. Well, you can see the gentleman, A, I would call him, and had lost about 162 pounds. You can see this was from a lab band. So the lab band can work, and it worked very well for this gentleman. That may and may not work for others. Another one. Okay, this patient, gentleman. Okay, this is another lab band before and after. 271 pound before, and almost like 2 years, 197 pound.
That's an amazing difference.
Oh, you can see a big difference in attitude. Look at the attitude. I mean, you can see really the posture and everything else. And this is amazing that I tell you about their psychological feeling after the operation. You see a 180-degree change in their personality. They're happy. I'm talking about the sleeve and the lap band because they are physiologic. They lose the weight in a healthy way. They don't lose the weight looking sick, ashy looking. There's, side effects is very minimum.
And I think we have more pictures that we can just go.
Okay. You have, right here is 90 pound. This is from a sleeve in almost a year. Excellent results from the sleeve, excellent attitude. Actually, this is interesting that his son, were also in competition who would lose more weight.
A nice father-son competition.
Exactly, and his son lost more weight. His son is in the 20s, and he had the same operation. But after he saw his dad surgery, and then he went and had his surgery, and actually they have lost almost more than 180, 190 pounds, both of them.
And
this is another sleeve procedure that lost about 155 pounds. I mean, you look at the body shape. The younger, they look 10 years younger than what they were before. And this is amazing where you see the weight loss comes off the face first, and you see how most of them had to change the driver license. They have to because they cannot.
And
go
I'm
to
sure
bank.
it's transforming for their lives. The emotional high they must have, the joy of life. I've actually seen some patients who've had that type of surgery, and they feel like totally new people.
This is great. Another example: 194 pound weight loss in almost 1 year. This guy is hit it hard, and actually they lose more weight by exercising more.
And I think in the patients I've seen, this inspires them to work out more, to lead healthier lifestyles, to exercise more.
Absolutely. This is interesting. That's the entire family had the surgery. The mother, father, and the daughter. Sparked by the daughter. The daughter had the surgery first. She lost 176 pounds. She pushed her dad and her mom to have the surgery, and all three families, they had the procedure. She's 21 years old. She's finishing. She's in college right now, and she started actually a website and a group to get the young adolescent and young people to understand what is bariatric surgery is about. And I think she had a great results.
2012 version of A Family Affair.
Exactly. This is a very cute girl, and you see she's 20 years old. When she had the surgery, I think she was 18 or 19 at the time, and she lost 104 pounds. And this girl is flamboyant. She comes in laughing, dancing, and she's great results from the sleeve. And that's what I see a rewarding thing when in these adolescents and young adults when they have the procedure. They have all their life ahead of them. And when they have this at younger age group and they see these results, they don't want to become heavy again.
Dr. Hawasli, is there anything about this young lady that comes to mind that was just shown? Is there anything that comes to mind that you remember or recall about why she couldn't lose weight before?
Weight loss, obesity in itself is multifactorial. It's genetic. It is has to do with hormones changes, and it's not like we say, "Oh, this is lazy person who doesn't want to lose weight." They try. Most patients, before they come to surgery, they have been on weight loss programs, and actually, people who have what we call the yo-yo dieting. We need them to be because we need them to know what dieting means. But what the yo-yo dieting is, they lose 20 pounds, they gain 40 pounds. Is the body gets used to the starvation situation. Say, wait a minute, you starved me once. I'm not going to let you starve me again to that point. I'm going to gain more weight now. So the next time I'm going to be on a diet with you, you're not going to drop me down to that level.
Body's pretty smart.
The body adapts. And that's why I tell the patient, you have to be in the right state of mind. And what we do for them is really a tool to help them to overcome this problem.
Sometimes you may want to address this. A patient may be concerned, am I going to lose my hair? Or if it's a lady, could she possibly have children? What sort of foods can they eat afterwards? Maybe you can answer some of that.
Actually, in the lap band and the sleeve, the physiologic operation, I tell the patient it's not a diet. You can eat anything you want. The difference is the amount. But also they have to have supplement, because the small volume of food they're going to eat is not going to be enough to give them the entire supplement that they need. So they have to be on some protein supplement. We tell them that they can sit on the table with anybody and eat, but they have to take their time. They have to chew the food very well. They cannot use what they used to before is bite it and swallow it.
Actually, that's good advice universally for everybody, isn't
absolutely,
it?
Absolutely.
We should all be eating that way.
Exactly. So they can eat anything they want after the surgery. The volume is smaller. They have to be watched for protein and vitamin deficiencies. So even if they have the physiologic operation, because the volume of food is small, we have to watch it. The hair loss is minimized if they have enough good nutrition, but you can lose more hair with the non-physiologic operation.
Dr. Hawasli, I just wanted to bring out, because we're going to have to close soon, how would a potential patient get in contact with you?
Actually, they can call the office, and we have a program coordinator that they can get them through, or they know when the seminars are on the website. They can see when the seminars are at the hospitals that we provide this procedure at, mainly at Beaumont, Grosse Pointe, and also at St. John Hospital. They can come in and listen to the seminar free of charge. They can, by direct contacting the office, making an appointment to come in and then have a review of their symptoms, a review of their problem, and see what the best operation for them. They can then check their insurance, because not all insurance cover all procedures. Some insurance requires a pre-operative certain period of time of medical supervised weight loss program. So not everybody is the same just to come in and have the surgery done from get-go. So there is at least about 4 to 6 weeks before the procedure can be done in terms of the requirement to be met.
It's probably a good thing.
Right, exactly.
Dr. Hawasli, it's been a pleasure having you. It's such an exciting bit of information that you gave us, and those before and after pictures, each of them, I'm sure, a special story. Thank you so much for coming in and being part of our show.
Thank you, David. I appreciate you inviting me.
It's my pleasure. And thank you to our viewers as well for tuning in. As always, we appreciate that you spend time with us. Take good care of yourselves and those around you. Have a great day, and we'll see you next time. Great.